So in my training, I must have worked on well over a dozen psychiatric units on a day-to-day basis, and on top of that, on call we have to visit units to deal with emergencies. So I've worked in well over 50, probably closer to 100 units, so I know what I'm talking about. The first thing I'd say is there's lots of different types of wards. So for example, I work in forensic psychiatry, so I work in secure wards, which are for offenders who are very high risk and very dangerous. There are also some wards that specialise in particular diagnoses, so eating disorder units would be a good example. Some wards depend on the patient's mental states, so PQs, Psychiatric Intensive Care Units, for example, are reserved for very agitated, very unwell patients, and they're there usually for a short period of time until their symptoms are controlled, and then they're transferred to other wards for long-term rehabilitation. I'm going to tell you about general adult wards because those are the most common type of wards for your typical presentation. I'd say it's a rough mix of about 50-50 people who are there voluntarily and people who are detained under the Mental Health Act. People who are voluntary patients can technically leave whenever they want to, although in reality, if staff are worried about them, for example, if they think there's a high risk of suicide, then they might call the doctor to assess the patient at that point and potentially detain them under the Mental Health Act at that point. But like I said, that's only if there's a level of concern, it's not routine. So in terms of the diagnoses, it's quite variable. So on a forensic ward where I work, where the patients have a history of aggression or violence, psychoses such as schizophrenia is very common. On general adult wards, on top of psychoses, you might have things like bipolar affective disorder, which involves periods of mania, or you could have somebody with depression who's come in after a suicide attempt, for example. If you want to know more about these diagnoses, I've done tons of videos about everything I've mentioned, so go check them out. Often patients have comorbid issues like drug and alcohol use, but it's very rarely the primary reason that they're on the ward. So what is the typical psychiatric patient like? Well, that's a trick question really. There's no such thing as a typical psychiatric patient. Just like everybody has different personalities, so does the average patient. Patients can have different symptoms that affect them to different degrees. So for example, you might have a few psychotic patients who are responding to voices or who are suffering from delusions or very paranoid, but that's not the norm, despite what Hollywood might like to depict. You might have patients that are very withdrawn or paranoid or depressed, so they might be in their room, you might barely see them on a psychiatric ward, or you might have people that are very well, so they might be towards the end of their rehabilitation journey. They might be a couple of days from discharge, in which case they might not have any obvious or acute symptoms of mental illness. So what I'm trying to say is it's just a big mix of very different presentations. Hello cruel world. What you just saw there was a tiny little tantalizing taste, kind of nutty, of a much longer episode. You should go check it out if you're interested. The link will be in the description below. If you're a fan of either true crime or mental illness, or the crossover between the two, then you've got to go and check out my main YouTube channel, A Psych for Sore Minds. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. My channel covers a whole range, a smorgasbord of topics related to true crime and mental illness. For example, high-profile true crime cases with my own kind of personal psychoanalysis of individuals. I discuss issues related to criminality. I discuss individual diagnoses. I give advice about psychiatric problems. I interview ex-patients. I do a lot. There is something for everybody on my channel, and I implore you to go and check it out. You can even steal some of my ideas, palm them off as your own to impress your friends and impress people at dinner parties. It's all good. I've got your back. Until next time, stay euthymic, check out my channel, and please do not forget, I love you.